Good morning. I'm Dr. Ken Kaiser. I serve as the chair of this National Academies Committee on a Fairer and More Equitable, Cost-Effective, and Transparent System of Donor Organ Procurement, Allocation, and Distribution. The name of the committee is a mouthful. Hopefully indicates the direction that we are going. So I'd like to welcome everybody to this open session of the committee's first meeting. We have almost all of the committee members and about 200 or so folks participating on the webcam part of the meeting. As part of the normal Academies process, there's some obligatory comments that I need to make at the beginning of this open session, after which we'll proceed with the agenda. First, I want to let everyone know that this is an open, on the record information gathering session. This is the second part of the first meeting of the committee. We convened yesterday virtually for the first time for several hours, and are convening again today virtually for the second part, which it will begin with this open session, and then we'll have a closed session after this is done. I want to make sure everyone understands that this is a information gathering session. We are here to ask some questions of the sponsors and to get some additional comments. But I want to emphasize, and perhaps it's obvious, but I want to make clear that the committee certainly has not come to any findings or conclusions or is not making any recommendations at this point. Indeed, this is the first meeting of a study that will continue over the course of the next year. I understand that in the course of the dialogue that will occur this morning, committee members may ask probing or even provocative questions. These should not be taken to mean that there is the committee has a particular perspective or view on the issue. But we are here to clarify some issues and to gain information. So nothing should be taken away from this forum that indicates any positions of the committee or of the National Academies. I would also want to make clear that the committee very much values public input, and we will be hosting a public workshop early next year, in which we hope to receive comments from additional experts as well as from the public at large. And all this is part of the information gathering process and the evidence gathering process that will inform the writing of the draft report. The draft report will be an iterative document that the committee will work on over the course of the year, and ultimately, when that is concluded, it will undergo external review by experts who are anonymous to the committee. The committee will then respond to the comments that are made by our expert reviewers. And at the end of that process, a final report will be produced and released by the National Academies. So moving to today, this, as I said, is the first part of our open session today. We're going to have the opportunity to hear from the sponsor of the study and to discuss some of the questions that have arisen about some of the what is in the statement of charge that was given to the committee, and to clarify some of the questions that committee members have as to where we should focus our efforts going forward. We'll also have the opportunity after we hear from the folks from the National Institutes of Health, to hear from the Organ Procurement and Transplantation Network, as well as the United Network for Organ Sharing, to gather some further input and context for the study. So I think those are all the obligatory things I need to say about the process and our purpose today.